Hello everyone, my name is Leah Ramos and today I will be presenting on the topic of hypertension. So let's get started. Let's define what is hypertension. Well, it is another name for high blood pressure. Blood pressure is measured on an instrument called a sphygmomanometer and are recorded as two numbers, systolic and diastolic, and are measured in millimeters of mercury. The systolic measurement is the upper number that indicates pressure blood is exerting against the artery wall when the heart is beating. In contrast, the diastolic number is the lower number that indicates the pressure blood is exerting against the artery wall when the heart is resting. Some people hold the systolic number more important than the diastolic, but both are key in determining hypertension. People can have high systolic blood pressures, high diastolic blood pressures, or even both. Moving right along, this chart shows the different ranges of blood pressure and their categories. First, the normal blood pressure is a reading that is less than 120 on the systolic side and less than 80 on the diastolic side. Next, we have pre-hypertension that starts at 120 and ranges to 139 on systolic side and 80 through 89 on the diastolic side. Hypertension stage 1 starts at a systolic reading from 140 to 159 and a diastolic reading from 90 to 99. The second stage of hypertension is any reading that is above 160 on the systolic side and above 100 on the diastolic side. Finally, we have the hypertensive crisis stage, which is any systolic reading above 180 and diastolic reading above 110. At this point, it is critical for you to contact your doctor right away. Further waiting can cause damage to your blood vessels, heart, and to your liver. So hypertension is considered the most common cardiovascular disease. About 75 million American adults have high blood pressure. That is about 1 out of every 3 people. High blood pressure is non-discriminatory as a disease, and it can develop at any range, from adults to elderly to even small children. Furthermore, high blood pressure can lead to increasing risk of heart diseases and stroke. Hypertension and heart disease are global health concerns. Presently, it is the leading cause of death in the United States. As we move on, I want to note that the next slide is probably one of the more important and shocking details about hypertension. If you are to remember anything from this presentation, I want you to remember and understand this simple fact. Are you ready? Okay, so hypertension is referred to as the silent killer. People who have high blood pressure don't know that they have it because hypertension does not have any symptoms. People may experience some dizziness, headaches, or facial flushing, but typically you cannot tell if someone has high blood pressure just by looking at them. For example, I have a friend who I consider to be very active. He goes to the gym and participates in sports such as basketball, swimming, and jogging. He has a moderate to slim physique, but I recently found out that he's been dealing with hypertension since he was very young. He takes medicine for it daily and has a sphygmomanometer to check his blood pressures. The only real way to knowing if you have high blood pressures is knowing your numbers and checking your pressures regularly. So, the next time you go to a Walmart or a Rite Aid, maybe take that time to check your pressures, just so you can know for sure. So if you have high blood pressures or elevated pressures, what can you do? Well, one of the most common recommended treatments is making lifestyle changes. This can include quitting smoking if you are a smoker, eating a healthy diet, decreasing your sodium intake to about less than 1500 milligrams, and limiting alcohol consumption. Also, it is a good idea to do aerobic exercises such as swimming, walking, or biking for at least 30 minutes 4 times during the week. People can also use medications such as ACE inhibitors, diuretics, and beta blockers, which are prescribed to people with chronic conditions or people over the age of 65. It is also recommended that people lose weight if they have high blood pressures with or also have the condition of being overweight or obese. So the article I chose that I found interesting was about an experiment testing out diet treatments for hypertensive patients. Researchers noted that a certain diet can decrease blood pressures in hypertensive patients without the use of medicine. This special diet they referred to was the DASH diet, which stands for Dietary Approaches to Stop Hypertension. This diet is quite simple. The idea is to eat more fruits, vegetables, and low-fat dairy foods while avoiding foods that are high in saturated fat, cholesterol, and trans fat. In this experiment, researchers test whether diet can lower blood pressures similarly to medication. The study included 412 adults around the ages of 23 to 76 years old. The participants were not allowed to use any anti-hypertensive medication during the experiment. Their blood pressure ranged on a systolic scale of 120 to about 150 millimeters of mercury, and on a diastolic scale of 80 to 90 millimeters of mercury. The people were categorized into 4 groups according to their systolic pressures. For 12 weeks, participants were randomly assigned to either the DASH diet or a controlled diet. In addition, there was a 4-week period where the subjects' sodium intake were moderated and regulated on 3 different levels: low, medium, and high. Low being allowed 50 millimoles of sodium, medium being 100 millimoles of sodium, and high being 150 millimoles of sodium. In the end, the DASH diet, in combination with the low sodium intake, produced the best results for the subjects. Participants with a systolic blood pressure of 130 to around 139 had an average reduction of their blood pressure from about 7 millimeters of mercury. Participants with a systolic blood pressure of 140 to 149 had an average reduction of 10. But the most surprising and probably the most exciting results out of the experiment was from the last group, which had a systolic blood pressure initially of 150. They had an average reduction of 21 millimeters of mercury to their blood pressures. So the positive results from this experiment are making researchers more interested and curious in testing this method out on patients with blood pressures over 160. They want to be able to develop new methods and continue to study this phenomenon in order to help more hypertensive patients. So to wrap up my presentation, I would like to go over some of the major takeaways from my presentation. Firstly, the number one thing I want to emphasize in this presentation is that hypertension is the silent killer. There are no symptoms observed until it's too late. It is important to check your blood pressures regularly and be active in monitoring your health. Second, hypertension is one of the leading causes of death in America. 75 people experience high blood pressures, and having hypertension begins at any age. And lastly, in order to treat hypertension, an important key is lifestyle changes in the form of creating a healthy diet and getting regular exercise. the DASH diet is the most recommended diet to reduce high blood pressure. And doing exercises such as walking, biking, or swimming can also reduce blood pressures. So, I hope you enjoyed my presentation on hypertension. I hope you learned a lot. And I thank you so much for listening. Goodbye.